when we're talking about in terms of setting up the office, the space is limited. We don't need a lot of space. When we're talking about autologous stem cells or even allogeneic, the only thing you need to set up an office is a simple, if you're talking allogeneic, it's just a simple setup. It's a small room. It's a nitrogen tank. It's a benchtop laminar flow hood. Because the only thing you're going to be doing there is it's unfreezing the vials, the sample, for thawing in your hand, holding them in your hand for 1 minute, and then you're ready for injection. If you're working with autologous lines, or it depends on to what extent you're doing. We have the G-cell machine, which is wonderful. It does it all. You just harvest a little bit of fat, and then the machine does the rest. Or if you're going to use enzymatic digestion, then you need a little bit, 3 or 4 more pieces of equipment. But everything can be set on a regular table. You don't need more than 15 to 20 square meters, which is 150 to 200 square foot of area. It's more than enough. Then what we advise, many of our doctors ask, they're doing the extraction in one room, and then they have to move the tissue, and they're going sometimes to the hallway with the tissue to do the processing on a separate room. We try to avoid that. What we're seeking is to avoid contamination as much as possible. So I think many clinics, they have this interconnected room where we are doing the extraction in an OR or a procedure room, and then internally you have another small room where you move inside through a door to the area where you're going to be processing the samples. That's something that's highly recommended. But really, the important message here is that in order to practice these techniques, that they're wonderful in their simplicity. It does not take a big setup. We get the question all the time. We're gonna build out a facility. Sometimes people think about complex type setup. That we don't need any of that. It's just remember the raw material here is the patient sometimes, and if you're using perinatal tissue, that's gonna come already prepared in vials that you're going to be storing in freezers or cryo in nitrogen tanks. And the procedure to unfreeze that, it's super simple. So there's no need for complex setup.